Natural medicines and the normal diet what we now recommend, low carbohydrate diet. His sugar was 82 in the morning, fasting, and 140 or 120 something after food. He and his wife has come. His wife's question is, Doctor, now his sugar is okay. Can we start the normal diet? I gave him one example. Now suppose your husband is drinking alcohol and his liver gets spoiled. And after some treatment his liver gets better. Can you start alcohol? I said, that is the way it is. And after control of sugar, you cannot go back to your diet because the diet is not good for you. It will again get back. See. So that's very important.
No, I thought with Ayurvedic you get some little liberation. More of Ayurveda, the urge to eat more will reduce. We have more urge. More urge is more Vata. Vata dominant personality. You need to evaluate what Drshashikant dominant. Where it gets you? Again, I think this particular thing. Keep in touch with Kumar. Some 3-page paper. Just take it and you know are you Vata or Pitta.
Further questions?
This Panchakarma, the Nasya Karma and Vamana Karma are with Panchakarma or there are different?
Again, we will not go much detail into Panchakarma. There are Panchakarma, what we do is, again, we evaluate the person. There are Purva Karmas and Paschatya Karma. Unless they evaluate a person, they will not be able to decide the form of body.
So Panchakarma means I come to know there is 5 types of...
5 types.
Yeah. So what are they?
One is Abhyanga, where they will give a massage. One, there is a purgation. They will make you vomit.
Yeah.
Vomit, they will work on Udana Prana. They will give you some medicated enema. Apana Prana can be balanced. So, vomiting is one.
Vomiting is Vamana Karma.
Vamana. Will not go for technical words. Vamana is one. Basti is one. What they will give enema. Abhyanga, what they give is the body oil massage, medicated oil massage. And purgation, Rakta Mokshana, there is one more, where they will let your blood out using a leech.
Okay.
The same thing practiced in China as a acupuncture and suction, cupping method. Same Rakta Mokshana, I want the blood to let out so that the body constitution will change. Last one can be Shirodhara or Nasya Karma or some other Swedana Karma, where they use a steam medicines. Okay.
Non-veg is very entertaining thing in Ayurveda. Or Ayurveda.
Ayurveda uses non-veg in some of the diseases. That's okay. Again, the body constitution, the food preference, what you choose differs your. So, for example, I use more of oily stuffs. So more of kapha prakriti. More of a non-vegetarian stuffs. Again, vata or kapha prakriti. Again, based on this particular detail history is very important. So to end, I want online. I request you to avoid all the online information because most of informations are not updated by a qualified person. I'll try to be online later on BangaloremedicalCenter.com. So there are many online YouTube videos, but you can. It's like a self-medication. I want to do operation on myself. It's not good. You just take a basic consultation from any preferred Ayurveda of your choice, and then do this. To end the session, I will add something very interesting. I mentioned some bits and pieces here and there. I mentioned about the 5 fingers and Agni, Vayu and all those. I use some very new context. I want to do some research on this later point. I use some form of a mudra in combination of breathing. Because breathing, I already mentioned that breathing increases Mahaprana. Yoga gives a very importance for breathing. And I mentioned sympathetic, parasympathetic activity. What is the best therapy is increase your parasympathetic activity. Whenever I am very angry, how will be my breathing? Fast, irregular, erratic. When I am very relaxed, how will be my breathing? Slow and steady. So it means that I can work on the emotions by working on the breathing. Is it possible? So mind is already wandering all the time. I want to lock the mind by using the constant even breathing. For example, I want you to do this right now. Hold your hands like this. Thumbs up. Encircle your thumb with other 4 fingers. Release your lower 4 fingers. Lower your knuckle area. Thumb touching the middle finger. So this is Shankha Mudra. And hold it in front of your chest. So Shankha Mudra. Again, just little introduction. I want to make you defocus. I don't want you to stress. So I want you to focus on the blood circulation around the thumb. Focus on that. Keep your eyes closed. To make your mind locked or wander only in something neutral, I'll ask you to breathe in 4 seconds. Hold your breath 4 seconds approximately. Breathing out 4 seconds. So this 4, 4, 4 constitutes 1 count. Breathing in 4 seconds. Holding the breath 4 seconds. Breathing out 4 seconds. Like this, I request you to do 20 counts morning, 20 counts evening for first 1 month. Is it okay?
You have to
Hold like this in front of your chest. Breathing in, holding, breathing out is a pattern. 4 seconds, 4 seconds, 4 seconds. I am making your mind locked, where indirectly your sympathetic overactivity is reduced, your parasympathetic stimulation is better. Mind is not thinking on unnecessary things and getting more hyperglycemic by stimulating your sympathetic activity. So next month, 444 is a name. 444 breathing technique plus Shankha Mudra. 20 times morning, 20 times evening, first 1 month. So second month, I want you to increase your lung volume by increasing the inhalation and exhalation. Breathing in 6 seconds, holding the breath 4 seconds, breathing out 6 seconds. 6, 4, 6, 20 morning, 20 evening. Are you able to follow this?
Yes, I can hold the breath for 4 seconds.
4 seconds.
Inhale 4 seconds is not possible. Like there is a stop. You cannot breathe.
Approximately. Then you can reduce into 3, 3, 3. No problem. Based on your capacity to inhale.
Same thing, art of living.
Art of living uses a combination of Vijnana Bhairatantra. Say for example, if I grow my beard long and wear some white dress, and I use one particular combination of meditation technique derived in Hatha Yoga Pradipika or Vijnana Bhairatantra. What Ravi Shankar uses is Ujjayi Pranayama, where you are hyperventilating. You are making your breathing more fast. And some point of time you will feel there is more stimulation of your brain, so you will feel some kind of visuals. So he called it as a Sudarshana Kriya. So I am trying to call this particular technique as my Kriya.
This is more, I think, more easy.
It's easy. So what I use is a simple Hatha Yoga technique of 4 seconds, 4 seconds, 4 seconds. But it's also psychotherapy technique where mind is locked. You are not thinking anything else. So third month onwards, 6, 6, 6, 30 times morning, 30 times evening for about 3 to 6 months. So by default, you are increasing your lung volume. Lung volume increases, your body's resources increases. Body's resources increases, your body tries to correct by itself slowly. And you are making this to happen by working on your breathing.
By blowing balloon is also one of the exercises.
Different. There are multiple exercises. Blowing balloon is one of the exercises. Keeping a candle for a little distance and blowing with the pursed mouth is one of the exercises. You can use many combinations.
In case in the middle of the day you are getting angry, you can do this.
You can do this. So if you are getting angry, you have to hold this very tight. As I said, this is Agni. Hold this very tight. All the anger on somebody else, you show it on this. And hold it just, even if you are not able to breathe, you hold this very tight. So it helps to make it as a thought dissociation technique. And making your thought to go away somewhere else. And your anger reduces spontaneously.
This has to be done only breathing. Only breathing here.
4, 4, 4, you start with the candle. Otherwise, breathing in as much as possible. Holding the breath as much as possible. Breathing out as much as possible. Thumbs up. Left. This is one of the mudras.
We have to sit down.
This is right. Sit on the sofa. Left hand. Mudra can be done any time, anywhere.
Left.
Even before food, after food, anytime, no problem. No problems with mudras. So there are around 729 mudras covered in.
Spoke about this. When should we do this?
You can use the Samana mudra. You can use. There are different mudras.
Even this we can use technically.
Focus on the 5 points which you are touching and keep your mind awareness on that. So indirectly you are stimulating the parasympathetic activity and your breathing will become normal. One exercise I told, it is for 6 months. 6 for 6, 20 morning, 20 morning. So for the diabetes, usually I use some other mudra for this. Hold your index finger. Touch your thumb with the middle finger. Touch your ring finger with the thumb. Let the little finger be straight. It is called as Apana Vayu Mudra. Apana Vayu, lower part of the abdomen. Again, pancreas and other parts are lower parts. So this is also called as Hridaya Mudra, heart. It's also good for heart and diabetes. They say this, but not much proven benefits, except for correlation that number of receptors are maximum. This also can be done. Good even for digestion. Digestion also is good because it's working on Apana.
So I'm happy to announce today that our aim is to reduce medicines. And I was just reading in somebody's quote that the main job of the doctor is to make the patient reduce medicines. And unfortunately it's thought otherwise, to give medicines. And today I think she has stopped all her medicines now. After 3 or 4 months of dietary therapy, she's been able to go off medicine and manage with diet and exercise. Congratulations.
First person.
First person to go off medicine.
I hope so.
But his temptations are more.
You have the control over ourselves,
Yeah.
then it's very good.
Yeah.
Beautifully told that we should have self-control.
Yeah.
Self-control is the best tool.
Yeah. So I hope to see more of you to go off medicines with good control. And there's a lot of science behind many of our ancient medicines which we don't know. So we should not be arrogant and say it's not good or it doesn't have any scientific background. Maybe today's science doesn't understand that thing. So with that thing, we should have a respect for all forms of medicine. That is why we always try to integrate various forms of medicine and see what best we can get. Ultimately, that should be the aim. And the same thing I also always tell my patients, whatever treatment you are taking, if it is working and you know it is working and you are getting your blood tested, I am fine with it. So there is no problem with that. So in fact, I was reading something about the Ayurvedic medicines. It is even those plants which have to be collected, they have to be collected in a particular season and in a particular time of the day. Only then you get the maximum benefit. But today it's all modern, even Ayurveda has become modern. So they just pluck it out and then put it in the factories and
What
then...
medicines we buy is actually there is no value for it.
Yeah, it will have value but not the real
releases the
value
power.
of the way it should be practiced. The plants have to be extracted at that time and given fresh. All those things can't happen with today. So there's a lot of science behind that. But we are able to get only that much of benefit because today it has to be supplied for wholesale purpose. So Himalaya or all the other companies, they have to do it in a different way. So that's happening. And I once again take this opportunity to thank Dr. Shashikant and his team. One, for promoting holistic and integrated medicine. Second, for taking his time and coming here and talking to us about the home remedies and Ayurvedic medicine in such detail. And thank you, Doctor. And,
diabetes center. So you come here for consultation.
He used to come earlier.
I started my career here from here.
Yeah.
I used to come
He used to-
teach here pregnancy yoga and other things. Used to teach yoga.
Even before doing MD yoga and rehabilitation, I was consulting, sir, can I do it or not do it? Or I was into a bit of dilemma and thinking that what I have to give it back. Most of the common answer I used to get is yoga and Ayurveda I have from Indian continent to give it back. So my mother is a diabetic and sir has treated her for a long time. Because of a distance I am not able to come so frequently. So I request you to take this initiative, motivate yourself to do a regular exercise, consult any of your Ayurveda doctor and get in touch with DrParamesh. Let it be a complete integration.
Sir, I have one doubt about the yoga.
Yeah.
While doing Surya Namaskar, I find it difficult for bending and touching the waist, the knee.
Yeah.
And getting up. Then I feel dizzy. Is it because of the BP?
Possibly, or it can be some form of a positional vertigo also. See, whatever exercise, if it is not very comfortable, please avoid it. See, there are two forms, Patanjali yoga